Hi, I am Dr. Richa Sharma, Senior Fertility Consultant at Medica Fertility. Today I am going to discuss about bulky uterus, its symptoms, causes and the treatment. What is bulky uterus? A bulky uterus is the generalized swelling of the uterine wall. This means the uterine size is above the normal size of a uterus. If the uterus enlarges because of reasons other than pregnancy, then it's a serious condition and needs medical attention. What are the symptoms of bulky uterus? There are several causes of bulky uterus and the symptoms may differ based on the cause of it. The common symptoms can be abnormal menstrual cycle, pressure on the uterus and the surrounding region, bleeding after menopause, frequent and quick urge to urinate, excessive bleeding during periods which may cause anemia, gaining weight around the lower abdomen. So now we will discuss these causes one by one. First is pregnancy. The most common reason for the uterus to enlarge is pregnancy. Second is adenomyosis. Adenomyosis is a diffuse thickening of the uterus that happens when the endometrium, that is the tissue coating the uterus, moves into the external muscle mass of the uterus. It is a non-cancerous condition but it's very painful, such that the patients will have symptoms during the periods and it may mimic like fibroids and they may have heavy periods also. Third condition is the fibroids. It is also one of the most commonly gynecological reason of being a bulky uterus. Fibroids are also non-cancerous and they are like tiny lumps or bulges which can weigh up to a few pounds and they may have different location within the cavity in the wall of the uterus or it can be outside the uterus. So depending upon the location they may have the different symptoms. So as per the age and the indication we have to go for the medical or surgical treatment. Fourth is the perimenopause. Perimenopause is a stage before menopause. So what happens that the lady will have the fluctuation in the hormone levels. That may be one of the reasons to have the temporary enlargement of the uterus, but generally it settles after menopause. Fifth is polycystic ovarian disease, PCOS. So it can be a disease or a syndrome as per the clinical situation of the patient. It's a medical condition which can make the uterus grow indirectly because it causes hormonal imbalance and that can lead to the abnormal menstrual cycle and the shedding of the endometrial lining. Sixth is the ovarian cyst. Cysts are generally asymptomatic but sometimes they may grow very big and also it depends like what kind of cysts they are, whether they are simple cysts which are physiological, they are endometriotic cyst that what we call as chocolate cyst, or whether it is related to some cancer, whether benign or malignant. So depending upon the pathology it may be added upon with the some other signs and the symptoms and it can indirectly affect the size of the uterus and it can have indirect health complications of the female. So we have to take care of that situation as per the symptoms the lady presents. Seventh is the endometrial cancer, that is the carcinoma. So uterine cancers can also cause a uterine enlargement and that can lead to the bulky uterus. Now we will discuss what are the various treatment methods which are available for the bulky uterus. That will actually depending upon the what is the underlying causative factor. Suppose if the patient has adenomyosis, so in those cases it can be medically managed with drugs like Brufen or combined contraception methods. Pills can be given which not only help to decrease the pain but also the excessive bleeding which patients have in such cases. In complicated cases, maybe patient have to last resort go for the hysterectomy. Second comes, suppose a patient has the fibroids. So fibroids can be managed in a better way as compared to the adenomyosis. They are generally large and can expand the uterus which may need some corrective surgeries. Regarding medical management in fibroids there is not much role but symptoms can be managed, like if patient has the heavy periods or irregular periods then they can be put on certain contraception pills. The pills may stop the development of the fibroids and reduce the bleeding during periods. Now comes if patient has the endometrial cancer. So cancers or tumors of the uterus and the endometrium are regularly treated by the radiotherapy, chemotherapy, surgery, or sometimes a combination of these. So the purpose of this video to tell about the bulky uterus is that because sometimes due to this bulky uterus, due to any of these reasons other than the pregnancy, the patient may have the infertility. So problem comes in those patients. So based on the whichever is the pathology, we have to rectify that. Suppose if patient has fibroids with recurrent failures or recurrent abortion, then first we have to rectify that, and accordingly we have to proceed for the treatment in the form of IUI or IVF as per the indication. How Medicare Fertility helps women to deal with the bulky uterus. Medicare Fertility clinics are among the top fertility clinics in Europe, and now they are in India. With state-of-art technology and technical expertise of doctors, we have been helping patients dealing with the fertility issues. You can contact Medicare Fertility, where you will get the best advice from the experienced infertility specialist who will suggest the best possible treatment for a bulky uterus. If you are unable to get pregnant after several attempts, you should consult us and find a solution for your problem. Thank you for watching this video. If you have any questions or concerns regarding bulky uterus, you can drop your questions in the comment section or call us on 786 2800 700.